The management of smoldering myeloma is changing in last years thanks to the wider availability of clinical trials. In general, we have to discuss about who is today the high-risk patient, because preventive treatment are for this category of patients. We continue to use the brilliant 2020 evaluation from PETEMA group, in which we know that high risk has seen a lot of clinical trials in last years, starting from Cura, in which lenalidomide dexamethasone was superior to observation, and now we have more than 15 years of expectations from this trial. But let's not forget that we have now also data with anti-CD38 daratumumab. Aquila study has shown a superiority also versus observation study. In general, I think that we are strongly waiting for result of other trials such as Ithaca, isatuximab, lenalidomide dexamethasone versus Lendex, in which I was really proud to be one of the investigators involved, and let's wait also for specific antibodies. There is ongoing EMN34 with elranatamab, phase 2, in which we are also treating our patient with the brilliant result, really fast response and deep response. Another eternal question is not only to treat or not to treat, in my opinion, absolutely to treat the high risk. The other question is how we can define today a functional high risk in this patient, and we should maybe include biology and for sure the genomic pattern of our patient, and new generation imaging. We study our patient with the PET-CT plus full body MRI in order to detect also pre-lesions. That is really important, because the tricky point is not to under-treat but also not to over-treat our patient, and this is another really important point. And moreover, the next future will be to understand if we should treat only high risk or maybe also low intermediate smoldering high risk. Some drugs are being placed for clinical trials also in this setting. For example, linvoseltamab, we will have a clinical trial with this drug covering all the smoldering and also high risk MGAS. In my idea, the end point is another important thing to solve, and the end point for smoldering myeloma should be MRD negativity, because in this case we should aim to eradicate the clone, to cure the patient, and this is the best wish that we give to all smoldering myeloma patients, to their family, and to all myeloma researchers that are fighting against also pre-myeloma status and not only symptomatic myeloma.